Good afternoon. My name is Dr. Paul Nassif. I'm a facial plastic and reconstructive surgeon. I specialize in all types of rhinoplasty, especially revision. Today is January 28th, 2008, and I'm answering questions from my video blog. And my initial question that I want to respond to is from an African American patient who specifically wanted to know about reducing the size of her nose. And some people call this a westernization rhinoplasty. I call it an ethnic rhinoplasty. Now, an ethnic rhinoplasty basically means that we're keeping the exact nose but just making it look better. You know, whether it's the tip less bulbous, this part, the bridge more narrow, or the nostrils also narrow. That to me is what an ethnic rhinoplasty is. We want to keep the patient looking natural. Okay? So, how do we do this? Well, many times when we look at a patient from the front, the bone separations will be pretty wide. And then the dorsum right here will be pretty low. So how do we build that up? Well, what we'll start to do initially is to reduce the nasal bones and bring them closer together right here. So that's called osteotomies, where we fracture the nasal bones in. Now, sometimes if the bones are too low to the face, performing osteotomies can be very challenging and cause complications such as asymmetry of the lateral nasal wall. So in certain situations we'll bring the nasal bones in. Then how do we build the dorsum up? Well, there's two types of tissue. Go ahead and do it and then I'll keep going so we can end.
Yeah, okay.
Okay. There are two types of tissue. There are two types of implants. Autologous implants, which is your own material, which is what I prefer, or alloplastic, which is a material that's not from you. It's a foreign material, such as Gore-Tex or silicone. So from the autologous standpoint, that's what we're going to focus on. And what we usually like to do is take cartilage, whether it's from your septum inside your nose, from this part of the ear, or from a rib, and we like either crushing it or dicing it up, and then wrapping it in fascia. Now, what's fascia? Fascia is tissue that we're going to use on top of the deep temporalis muscle. It's right here. It's the temporalis muscle, and we're going to be using the temporalis fascia. And it's not going to really cause any type of complications with your chewing, because this is the big muscle that lifts up your jaw. And we're going to take a little bit of that tissue just on top of the muscle. The incision is made in the hairline, approximately that long. It heals very well. We don't shave any hair, and within a week you'll even forget about that you had any procedures performed there. So with the combination of the fascia and the diced or crushed cartilage, we make a little, let's call it a burrito. And then we place it from either just the area here called the radix, if this is all we need to build up, or all the way along the dorsum. Okay? All the way. So that's how we augment the dorsum. The next part is the tip. Sometimes the skin is very, very thick over the tip, which means no matter what we do, we're still going to have thick skin. Now, what some physicians do, which to me I feel is the wrong way, they'll take a lot of cartilage. They'll remove a lot of cartilage. And by removing a lot of cartilage, that will cause the nose to collapse. It will fall and become even wider. So what we like to do is take the current existing cartilage, narrow it by using sutures or stitches, and possibly narrowing and removing some of the tip cartilage. But again, it really depends on the nature of the cartilage. If it's very strong, we can remove some. If it's very weak, we want to keep that strength there by not removing any cartilage. And we'll use different types of cartilage grafting called a strut. We put right inside the middle part of the nose all the way down to the base of the nose. That will keep the nose nice and strong. We'll also use onlay grafts of crushed cartilage to augment and lift this part up right through here, called the infratip lobule or the dome. And the more we augment it, it will give us more projection, which is often what's lacking in ethnic noses. And the more we augment it, the more narrow that it will appear from the front. It's the same analogy as like a big round tent. If you put a pole in the middle of the tent and lift it up, from above the tent will look more narrow. Same thing with augmenting the tip. will make it look more narrow. So after we take care of the tip and narrow it, then we want to deal with the nostrils last. And sometimes if the nostrils really flare out, we'll need to perform what we call alar base reduction. I like using the term weir incisions, where an incision is made inside the crease, but if it's done properly, the scar is absolutely minimal, and the nostril will look normal, and we can remove some of the flaring of the nostril. And if it's too wide from above, inside, we'll even do something called the nasal sill, where we'll remove a piece of tissue inside here. And this will bring in the whole entire nostril. So now what we've looked at is taking care of the upper 2/3 of the nose by narrowing it, possibly elongating or building it out. Same thing with the tip from the front, making it more narrow. From the profile, possibly adding projection. And from the nostrils, softening it, making them less flared. So this, in summary, is the simplest version of an ethnic rhinoplasty. But again, we want to keep that person looking natural and looking like themselves. Sometimes with ethnic rhinoplasties, we may need to add a chin implant also. And that's done by a small incision right here, underneath the chin. It's about that big. And the implant fits just on the bottom part of the jaw. And if it's done properly, you won't even be able to notice it or feel it. Your profile will be augmented, and you'll see very little change from your front. Okay? So that's our first question, is ethnic rhinoplasty.